Ready?
Yes.
All right, so we're gonna do causes of renal failure.
Got it.
Okay. So heart pumps out the
Aorta.
down the abdominal aorta and directly to the
Renal
renal arteries, which provide blood flow to the kidney. What happened? Did you pop your
That was
back or
good.
something? Oh, no, you're just happy y'all got it. Oh, okay. I thought like something happened, like your bra popped or something. Because you were like, oh. All right. Okay, so we're gonna talk about what can cause kidney failure. There's pre-renal, which means anything before, intrarenal is anything inside, and then post-renal after. Okay, so pre-renal, what could cause kidney failure before the kidneys? Oh, what the?
Shock.
Yes, shock. Right? If the kidneys do not get blood flow, do they not die?
Oh yeah.
Yes.
Oh, yes, yes. So you can say it in a million different ways, but anything before the kidney or pre-renal is going to be a blood flow issue. You can say hypovolemia, which means
Low pressure. Low volume.
low volume, right? They don't have enough volume to perfuse the kidneys. You could say dehydration. That's still low volume. You could say hypovolemic shock. Low blood volume. Do you understand what I'm saying?
Yes.
Okay, so it doesn't matter how you say it. It's your kidneys did not get enough blood flow and then they have died. Now, can they rise from the dead?
Yes.
Yes, that's why the body pulls blood flow away from them in shock, right? So, but it depends on how long they went without blood flow. If we coded somebody for 90 minutes, their kidneys are probably not coming back, right? They may have kidney failure for the rest of their life, even though we brought them back to life. Okay. So it depends on how long it went without blood flow to how well their kidneys are going to do afterwards. Do you understand what I'm saying?
Yes.
Okay. The only other thing that could possibly happen pre-renal, which I didn't even write it down because I don't know if they would ever touch it, is if there's a clot in the renal artery. Doesn't happen very often, but if there's a clot, that's still a blood flow issue. Y'all can draw a clot in there if you want to. Okay. Intrarenal means anything inside. Okay. So this is damage to the glomeruli. This would be damage to the nephrons, damage to the actual kidney. Okay. When I was in nursing school, I thought AKI meant like literally somebody punched you in the kidney. Do you know how often that happens? How do you punch somebody in the back? You know, like that is not what AKI means, acute kidney injury. Now, could it happen that way if you get beat to shit?
Yeah.
Maybe, but you know how hard it is to kick somebody in the kidney. It's up here. You'd have to be like a, yeah, like a kung fu fighter or something. So that's not really what AKI means. An acute kidney injury means your kidneys are like injured because they didn't get blood flow or because something bad happened inside the kidneys, usually a disease process. Now we're going to go over these really quickly because we'll talk about them later more in detail, but do y'all know what APSGN is?
It's like post-strep.
It's a post-strep glomerulonephritis. So we will talk about this in great detail, but basically what happens is you get a strep infection, your body responds by producing an antibody, right? To like kill the strep. The antigen antibody complexes are very large and the only way to get rid of them is through the kidneys. So these complexes go to the kidneys. The glomeruli is only this big. The complexes are this big. So they rip their way through your glomeruli. The glomeruli bleeds, obviously, because you ripped it and then it swells shut. That's bad. Because you can't get rid of any fluid or anything. Okay. So that would be something that's happening inside the kidney because the glomeruli are inside the kidney. Yes. What is nephrotic syndrome?
Protein.
Yeah. So, but we don't know exactly what causes it. What we do know is there's some kind of damage to the glomeruli. So like an APSGN, the doors are slammed shut and they're swollen. In nephrotic syndrome, for whatever reason, the glass doors break and they are wide open. So they allow protein. Okay. They allow proteins to come out and other things to come out that wouldn't normally come out before. That's damage to the glomeruli. That is a intrarenal problem. Yeah. We'll talk more later too. Okay. That was more than your doctor taught you. What is pyelonephritis?
Inflammation.
Infection of the kidney. It's an infection of the kidney.
Is that where the blood comes out in your
You can have some blood, but mostly it's just pus.
Okay.
No,
Ooh, yeah.
no big deal. Just, pus in your urine seems normal. All right. So pyelonephritis is infection of the kidney. Okay. Nephrotoxic drugs. And I mentioned those at the beginning on that first sheet, right? So big ones are like vancomycin, gentamicin, like big ones like that. Okay. Malignant hypertension. Now malignant doesn't mean cancerous in this case. Okay. It just means like this is very bad. All right. Hypertension. So we said hypotension will cause what type of renal failure?
Shock.
What type of renal failure?
pre-
Pre-renal. But hypertension will cause intrarenal because you've got the sliding glass doors again, right? What happens if you are pointing a giant fire hose and spraying it at these glass doors?
Gonna break.
It's going to bust them open. So hypertension over time will bust up all your glomeruli. Does that make sense?
Yes.
Okay. All right. Lupus. What are two keywords for lupus?
Skin and the
Skin and Kidneys,
Sorry.
sister. All right, lupus is what type of disorder?
Autoimmune.
Autoimmune, and it likes to attack the
Kidney.
and the.
Kidney.
Oh, you're afraid to say it now?
Yeah.
Okay, all right. Acute tubular necrosis. So acute means
Short-term.
right now.
Yeah.
Acute means it's happening right now. Tubular. Renal
Renal.
tubules. Necrosis.
Death.
Dead. It would be bad if your renal tubules were gone. Yes?
Yes.
Okay, so that's all stuff that's happening inside the kidneys. Do we understand?
Yes.
All right, now let's look at post-renal, things that are happening outside or after the kidneys, okay? It's got to be some kind of obstruction, right? Right?
Yes.
Okay, so you could see a renal calculi. What's renal calculi? A kidney stone. You see, I drew one right here. If it's blocking, like it's in the ureters and it's blocking, then can the urine get out?
No.
No, so it's stuck in here and it's going to make the kidney big and full of urine. What's that called when your kidney is big, giant, full of water? No, urinary retention's here in the
Oh,
bladder.
yeah.
Okay. When your kidneys get very large, full of fluid, full of water. What's the term for water? Hydro. What's the term for kidney? Neph. So hydronephrosis. Yes, 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 Lord. All right. So a kidney stone that could be blocking that side, right, can cause urine to back up and cause kidney damage. Yeah.
Yes.
What is BPH?
Benign prostatic
Mhm.
hypertrophy.
Very good. Benign prostatic hypertrophy. Is it cancer?
No.
No, because it's benign. Where is the prostate?
Wrapped around.
It's wrapped around the bladder neck. See, I drew it right here. The prostate is wrapped around the bladder neck. So if there's something wrong with the prostate and it is swollen or it is like big, it's going to like squeeze on the bladder neck and squeeze on the urethra.
Mhm.
Yeah.
Yes.
So if urine can't get through, it's going to back up into the ureters. It's going to back up into the kidney and cause hydronephrosis, which will eventually cause kidney failure. Yeah.
Yeah.
Okay. Any kind of tumors down there. And this could be like female tumors, right? This could be an ovarian, something, because it's all like all right there in the pelvis,
Mhm.
right? So any kind of tumor that's on there could be colon, any of those things. What is VUR? Have y'all heard of it before? Do you know what this is? Okay, then I will write it on the board because it's a new concept. Okay, so it is vesico-ureteral reflux. Vesico-ureteral reflux. You know what GERD is?
Yeah.
It's the GERD of the ureters. Okay, so the urine goes down. It's like, whoop, nope, goes back up, goes back down, whoop, goes back up, just like GERD does in your stomach. Yeah.
Yes.
Okay. So this is usually caused by a structural defect. Okay. So, and this is something you're born with. All right. So if this is your kidneys here. Okay. What's coming off the kidneys right here? And what is this tube right here that comes off the kidneys?
Ureter.
The ureters. Okay. And then that goes into your
Bladder.
bladder. Okay. And then your bladder goes into your urethra, and then you pee stuff out. But what the VUR is they have some kind of structural defect of the ureters. Okay. So maybe their ureters go like this. They're very narrowed, right?
Mhm.
So when they try to pee, like it goes down, but it's like, ooh, it's kind of near, like I can't quite, I'm gonna go back up. I'm gonna go down. Do y'all see how it's the GERD of the ureters?
Yes.
So they can't quite get rid of the urine. So where does it back up?
Mhm.
It backs up into the kidney. Okay. There's 4 different stages of VUR. Maybe that's what you, no, okay.
Oh.
So there's stage 1 through stage 4, and they go in order of severity. Stage 1 or stage 2, like I don't really do a whole lot about. Sometimes when the kid gets bigger, they'll just grow out of it because their ureters get bigger. And they kind of stretch out a little bit, but grades 3 and 4 have to be surgically corrected because a grade 3 or 4 might look something like this, right? Urine's not going to go through there very well, right?
Yeah.
And so it'll go down and come back up and go down, and that urine just sits in there for a long period of time before it actually gets down to the bladder. So what do you think? Patients with VUR, what do we see? Okay, if this urine's been sitting in here for a very long time before it gets down to the bladder, what do you think you're gonna see?
Infections.
Yeah, they get frequent UTIs, and usually as a baby, and that's how we're like, UTIs in a baby is not normal. So that's how we would know, like, this isn't right, right? So in VUR, if it's 3 or 4, they have to go and do surgery on it. If it's 1 or 2, they may just give like low dose prophylactic antibiotics. So that way the kid doesn't keep getting UTI after UTI after UTI until hopefully they grow out of it. Does this make sense what VUR is?
Yes.
Okay. So that could be a cause of, or post-renal cause of kidney failure. Okay. Do we understand?
Yes.
What is prostatitis?
Inflammation of the prostate.
Yeah. And where's the prostate?
Around-
What is the prostate's job?
It is the fluid that the semen is in.
It's the fluid that the sperm is in, right? So it,
Sperm.
yes. Okay. You're turning red. So sperm is just the swimmers, and those come from the testicles,
Yeah.
right? But there has to be fluid, like a medium at which they can swim in. Your face is so funny. And so the prostate makes the seminal fluid. So both of those have to work together for a dude to ejaculate. Yes? Because if you can't just spit out swimmers, that'd be so creepy. It's like they're coming for you. Yeah, it has to be able to swim in some kind of fluid. So that's what the prostate does. Okay. But when you have prostatitis and it's big and it's swollen, it's going to wrap around the bladder neck and it's going to like squeeze it. And then they can't get any urine out. It's going to back up. Do we understand?
Yes.
Do you understand prerenal, interrenal, postrenal?
Yes.
Good. Good job. Good job, everyone.
Your face did